Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, April 13th, giving you the update from Albany Med. All right, Fred, we'll pop into the numbers. We'll put up the first graph. Here's the capital region. People currently admitted to the hospital with a diagnosis of COVID. We're at 105 in the capital region. Again, we remind everybody that maxed out at about 550 a couple months ago. And the regional call today, which is a similar area, not exactly the same.
A few more hospitals, but 123. Last week was 121. So both sets of numbers, Dennis, tell us that we're basically flat.
Okay. Let's take a look at admissions and discharges here at the medical center. On this graph, what you can see is over the last 4 or 5 days, we've had slightly more admissions than discharges. Sometimes this is a phenomenon on the weekend, so we'll find out in a day or two if we've brought a couple more discharges out the door.
We do tend to discharge more people in the beginning of the week, and then obviously they come in over the weekend.
Right. The percent positive in the capital region is still around 2.2, 2.3%. So that's what's driving that.
That's right.
Let's look at the morning census here in the medical center. So the number currently is 38. Let's break that down. It's 24 on the floor, 14 in the ICU. 5 of them are on ventilators. I want to come back to the ICU number in a second, Fred, because that has to do with the region. Just a couple more numbers. No longer infectious of those 38, 5. Okay, and then just the age breakdown, because I know a lot of people ask about this. So of the 38 in the hospital, for those that are over the age of 50, that's 32 of them. And so 6 of them are under the age of 50, and of those, if you want to break it down to those, say, under the age of 30, we only have 3. But going back to the ICU numbers, Fred, we have 14. That represents kind of the majority of the ICU admissions in the region.
It is, Dennis. So on the call this morning, the other hospitals have numbers like 2, 3, 1 in their ICU. So we are about 50% of the ICU patients in the region right now.
All right, so the whole region working very hard. We want to thank, in particular, our ICU working very hard for that population.
They're doing a tremendous job.
Speaking of working hard and doing a tremendous job, the Capital Region Vaccine Network, hard at work. Let's update the numbers there. Fred, we are at 465,000 people who have received at least 1 dose of a vaccine. And that represents 43% of the population that's eligible. And then if you look at those who have completed the series, which is either the 2 shots, if it's a 2-shot series, or 1 if it's the 1-shot series, 324,000. So now 30% have done so. So remarkable work.
It really is amazing. And here in Albany County, where we're situated, we're closing in on 50% having received that first dose.
A lot of work everywhere. Now, obviously, a lot of the news today, we were sitting in a room at the same time when it came across the news feed, a pause in the United States on the administration of the Johnson & Johnson vaccine. Let's talk about that, Fred. First of all, who made that decision and why did they make that decision?
So, Dennis, that's a decision made by the FDA in conjunction with the CDC.
Okay.
And so all federal administration sites stopped, and then they recommended that other sites not administer in this pause, and that's happening, I think, around the country. So, Dennis, it's a relatively small, rare complication that they've identified. Literally 6 people with blood clots out of over 6 million people who've received the vaccine.
All right. It is a small number. Now, that being said, the Capital Region Vaccine Network did its hub call this week. Actually, we did it today. And so in this area, if you were a place that was going to administer Johnson & Johnson, and if you had the opportunity instead to use Pfizer or Moderna, they've switched over to using that. If Johnson & Johnson is the only vaccine they had available, currently they're going to reschedule those people until we get further guidance.
Yes. So, you know, Dennis, while there is a pause, and that's something for us to be thinking about, it is good news, right?
I do. I think so.
You know, we're looking that carefully at how people react to the vaccine that we've picked up on 6 events and are pausing to see whether or not there's some relationship. Is this causal or is this just an incidental finding?
Right. So I think the term that's been used is out of an abundance of caution.
Yes.
They're going to hit the pause button. I think for me what that means is going forward, if the Johnson & Johnson vaccine is used again, the public can be reassured that they've taken extra scrutiny, hypervigilance to look at the safety profile of that to make sure it can be used going forward.
And Dennis, I think it'll be used again.
Very good. And honestly, the other question that comes up is if I'm somebody who has received the Johnson & Johnson vaccine, should I be concerned? And I think the answer there is a clear no. There's no reason for you to be concerned. And then the additional recommendation is if you are experiencing symptoms that concern you, which has been defined as an unexplained headache, an unexplained swelling of a limb, abdominal pain, or shortness of breath, and you're within 3 weeks of getting the vaccine, and if you are concerned, contact your provider. Now, we know, Fred, based on the numbers you just said, statistically speaking, if you have those symptoms, it's not going to be the vaccine, but if you have any concerns, you can reach out and talk to your doctor.
Reach out to your doctor or your other practitioner. We're talking about an episode 1 in a million.
Right.
That's the episode.
All right,
1
very
in a million.
good. All right, so we'll update more about that on Thursday. Fred, Albany Business Review recently published, they call it the Empire Blue Cross Whole Health Hero. And these are individuals or companies that have been recognized in their efforts related to the pandemic.
Yes.
And we have somebody on this campus who's been very duly recognized.
And that is Scott Beagle. Scott Beagle is one of our pulmonary critical care docs. He's actually the medical director of the ICU, has just done an incredible job through this pandemic, the work that he's done in the ICU caring for the sickest of the sick. Scott is a native,
Yes.
Grew up locally,
Yes.
was a respiratory therapist
Yes, he
before
was.
became a doctor, has been here for more than 25 years, I
sure.
think, as a physician. He's a dedicated, empathetic, just a terrific provider. So well-deserved recognition by the Business Review for Scott.
Absolutely. Congratulations to
Congrats.
Scott. Additional congratulations for those who've been reading the Albany Med intranet page. There was a story recently on our autism medical home, and we wanted to talk a little bit about that today. Fred, what is an autism medical home?
So Dennis, this is a special clinic for kids with autism. Kids with autism respond differently than others to interactions with other people, loud noises, etc. So this is a clinic that's set up and functions in a way that is best for those children when they come in to receive care.
First in the region, only in the capital region.
Only in the capital region, that's right, Dennis.
A lot of people working on it. Dr. Karen Schottler-Thal to be recognized for her efforts, and everybody else. A very important work and something that we provide uniquely in this region.
That's right.
Very good.
Part of our mission, Dennis.
Part of our mission. Speaking of our mission today, we were outside. We had a great press conference with CDTA. This is something that we wanted to celebrate. There's a community partnership that's been going on for a couple years. An opportunity given to us by CDTA so that our employees and our students, by using their ID badge, can get on and ride CDTA for free. And Fred, the numbers are pretty remarkable for the bus ride. And in addition to that, there's these bicycles that people have seen partnering with CDTA and CDPHP that allows people to bike as well.
So Dennis, for our students and our staff, over 100,000 rides.
Last year.
100,000 rides last year, just amazing. And the bikes that CDTA and CDPHP sponsor, over 5,000.
Over 5,000. You know, the latter one is important because we've talked about this, Fred, the importance that we remind ourselves, especially in the pandemic, to be healthy, healthy choices, exercise, staying fit. This is congruent with that theme.
It's transportation, but it's great exercise. I love to ride my bike.
Absolutely. And in addition to that, getting back to the bus ride piece, the workers who come in here are essential workers.
They are.
The CDTA team that transports them around are essential workers. So
they are as well.
They've been critically necessary in the last year to making sure that we have the staff available to fight in the pandemic. So I want to thank Dr. John Bennett from CDPHP and Carm Bazil, who's the president and CEO of CDTA, two really great community leaders.
Absolutely.
So congratulations to both of them. So that'll do it, I think, for the week.
I think so.
All right, good. We'll be back again on Thursday. We'll see you in 2 days. We ask that you once again please take care of yourself, take care of each other, and we'll see you in 2 days.